Good day, citizens of the free world. From border to border, coast to coast, and to all the ships at sea, I bring you a warm welcome. This is your correspondent, Jim Tate, and thanks for tuning into the Tate Chronicles. Please join me as we cut through the fog that exists at the leading edge of healthcare technology. Our mission is simple. We're searching for beneficial disruption in healthcare from emerging technologies. I'm very glad to say that my guest today is Brennan Bennett. He's the founder of Blockchain Healthcare Review. Brennan, thanks for joining me and our audience today on this episode of the Tate Chronicles.
Thank you, Jim. Very glad to be here.
I've been a follower of the Blockchain Healthcare Review for I'm not sure how long, but for some number of months. And I've always found it to be a good resource. And that's really my first question. Kind of is, why did you start the Blockchain Healthcare Review, and who is the audience? What are you trying to do there, Brennan?
Absolutely. So the genesis of the concept of Blockchain Healthcare Review started in mid to late 2016. Honestly, it was really to consolidate the enormous amount of information I was going through at the time. I was writing a master's thesis on blockchain innovation and pharmacy operations. I had just joined Humana's blockchain team when I was working there as a strategy consultant. So blockchain and healthcare was literally every breathing second of my day, from school to work to passions, everything. So the genesis really was to put up a flag and see what would happen, start writing about it, consolidate the information. I have a digital background, digital branding, so I just put what I was reading and consuming online, and then as my technology and business acumen grew, so did the message. It quickly snowballed into industry engagements with HIMSS and IEEE and a few others, and being able to actually publicly discuss what I was writing about in front of other people. That's how things really got going until it evolved into what you see now, which is a strategy and innovation firm spanning both development, innovation, product ideation, but also growth hacking, growth marketing across enterprise, startup, and the federal space. So it's really evolved into something that I'm pretty happy about.
Well, and so it sounds like you have really expanded beyond just the journalistic reporting and keeping folks updated on blockchain and healthcare. You're doing quite a bit of consultancy work also, it sounds, as the whole field matures.
Absolutely. What differentiates us, blockchain from a development perspective and consultancy perspective, it's pretty busy space these days. But what separates us is, two things. One, we never lost sight of consumer engagement. One of the biggest reasons I got into healthcare in the first place was to figure out how to help people, period. So the heartbeat of Blockchain Healthcare Review really is bringing solutions to consumers who are experiencing healthcare problems. They're looking to free market opportunities that healthcare startups or technology solutions provide that their providers may or may not also provide. But in doing so, we also want to make sure that we're guiding those, providing that integrity and that guidance that we've learned along the way for those larger solutions and larger organizations to address what the public actually needs in the healthcare space and what they're looking for and what they're willing to adopt. And the other part is cutting through all the crypto mania, right? Cutting through CNBC reports on Bitcoin and all that crap, just dealing with the technology as a business solution and what that means to parties, both enterprise, small business, and startup, but how it relates to consumers. More recently, we've opened up a federal wing, looking at some departments in the federal government that are very interested in engaging, say, their personnel in their department, how they can deliver better healthcare insights and budgetary insights as well. So that message has resonated across the spectrum that kind of separates us from academic peer-reviewed journals or hardcore engineering white papers or just speaking strictly about enterprise. Yes, we do that, but our editorial engages people like yourself that just may be interested in how you individually get involved in something like this. Where do you go? What do you need? What are your interests in healthcare? I'll round that up with the real cool example I had this summer. Somebody very close to me came to me with a specific healthcare issue saying they can't get coverage. They were denied. Do I know of any blockchain solutions that could help? It was a dermatology issue. Just so happens we do. I advised on a dermatology and AI startup, pointing them in a direction. 2 days later, they had a diagnosis and a treatment plan. Totally outside the spectrum of the provider, totally outside the spectrum of the insurance. It was better treatment, better coverage, and better insights into the problem. Thankfully, it didn't turn out to be cancerous, but 2 days versus 2 months, that's quite a big time difference.
Exactly. Well, Brennan, one thing you mentioned was as a good term, I think, the mania around the cryptocurrencies, and that cryptocurrency has, in some ways, almost become Velcroed for at least a couple of years to blockchain technology and or distributed ledger technology. So when the use cases were first started coming up, people were talking about them and selling tokens and funding ideas and trying to do things, there was a real mania there. And it seems like during 2018, people have settled down quite a bit. I think we kind of went through, and maybe we're still in a little bit what they might call a trough of disillusionment. And 2019 is starting to look like some real-world use cases that actually bring value out there. Is that kind of the trajectory you've seen? We were way up, everything was promised, and now I guess the whole domain is it's still immature, but at least we're past that flash in the pan episode we went through for a couple of years there. I'm hoping so. What are your thoughts on that?
Well, yeah, I hope so too. I'm in my 30s, and I think I had more heart attacks last year than I care to have for the rest of my life. It has been a rough ride for crypto, but a couple things I do want to call out in particular. This is a great subject to really hit the why blockchain conversation that is just incessantly always going to be there. As cryptos evolved in the last couple of years, the blockchain applications, they really only solved what I would consider channels of broader business ecosystems, right? So they solve one or two use cases or one or two issues within a broader business ecosystem. So, of course, adoption isn't going to be massive for every single application because their use isn't necessarily as big as it would if you address the ecosystem as a whole rather than one particular channel within a broader ecosystem. So, just as the information age, I think there's a show out right now, Valley of the Boom, that goes out and really kind of talks about the insanity of the first half decade or so of the information age and how commercial web came about. Same thing, same industry, same type of evolution, just different type of technology. The difference now is that tokens can or can't be part of the solution. We are in a very interesting part, at least our firm at Blockchain Healthcare Review is in some very, what I would consider forward-thinking conversations about larger-than-life business ecosystems at state levels, at national levels that don't actually have to be tokenized to function. It's just blockchain as an infrastructure rather than an actual trading of tokenized assets. So the conversation's already there about how this is going to evolve into the SAP-type vision. But what I do like about how tokens have evolved is that the focus is around commoditizing integrity, right? Which is, in my opinion, have been taken as the information age came about. Look no further than Facebook and a few others, even 23andMe, that kind of take information and do what they will with it. So I'm all for the continued evolution of tokenization under the aspect that the use cases be of broader interoperable capabilities. And now that we have that technology, we have strong technology to go cross-platform, cross-chain, cross-wallet, whatever you want to call it, to start stitching together business ecosystems at a bigger level, but have the root, business logic apply to whatever blockchain protocol works best for them. And that's something that Blockchain Healthcare Review is really bridging from a partnership perspective and bringing in the right players, the right conversations to the right business. I think the token market will bounce back. I don't think it's been cold to the point where it'll never gain validity again. But I do think that from what I've experienced at conventions, for example, or summits, the questions that people are asking in public have substantially matured. The very first conferences I started going to, 2015, 2016, they were just 101, pre-101 type questions to speakers and to panels that were speaking very advanced topics. And now, people are asking both through our editorial and in the public very advanced questions, which tells me people are doing the homework, right? They're doing the homework on the basic technology stuff. And when that comes to investors, again, understanding the business use case of a token or an application can be rather complicated in healthcare as it is in crypto economics. So we try to serve that medium as well, because at the end of the day, it's all part of adoption, and that's our main mission.
Well, you mentioned some things there, Brennan, around use cases, and I kind of see these in one area that is right in front of us, and one area we don't know where they're going to go. And so I'd like to kind of break those down, and I'll outline the two aspects. One is we don't know where distributed ledger technology is going to go. Just when I was talking to a fellow yesterday, and he said when Steve Jobs introduced that iPhone, we didn't know it was going to lead to Uber. But without that iPhone, we wouldn't have Uber. And so we don't know what use cases or initiatives are going to come out of blockchain. There's an unknown part of that, but there is a known part, and where the fundamental positive attributes of blockchain can bring efficiency to existing business processes. It looks like that's where the initial real use cases are going to be. So let's talk about some of those. I know one kind of slam dunk when people talk about a lot. We're not even going to talk about electronic health information, exchange of that. A lot of issues around that. That may or may not happen. There's some promise there. But such things as provider credentialing, to be able to put a provider's credential on a blockchain so it's validated, it's trusted. Nobody has to spend 4 to 6 weeks to credential a provider. Supply chain, pharmaceutical supply chain, to track those drugs throughout the entire supply chain. Just kind of top of your head, do you have any other examples like that are pretty much like slam dunk, real world applications that work's being done on, that doesn't need to be a change in culture or anything else? It's just the blockchain bringing added value to an existing situation.
Yeah, I do. I think there's multiple answers to that question, but 2019, I think, is from what I've seen, where a lot of mainnets come online for this space. So Q1 probably a little quiet. I would say if you want to look towards productionized companies, I'm aware of Chronicles, for example, out of San Francisco, working in the back end of supply chain for building what I consider interoperable supply chains between pharmacy manufacturers. So you're seeing a very, very drip, slow release of productionized methods and models in the enterprise space. I believe even Humana has recently launched I don't want to call it a full-blown production model, but they do have an operational infrastructure, and now bringing on partners like Quest Diagnostics in terms of very simple stuff like data verification, testing verification, stuff that takes the redundancy out of healthcare delivery, which decreases the cost of healthcare as a business. The real question is, how is that going to apply to consumers down the line? Because I don't see drug prices going down because pharmacy manufacturing and supply chain is cheaper. I see drug pricing going down because it's cheaper to develop drugs. And that is, going back to the Uber example, being able to have the clinical informatics to understand drug discovery and cutting that cost down, that might affect consumers down the road. That might, not having 10 years, $10 billion to develop a drug, doing it in less than 5 for a tenth of the cost, maybe even less than that because of the AI infusion in blockchain. That might be the Uber of blockchain as it comes forth.
you know, one thing you mentioned there looked to be a number of potential applications that could be involved with clinical research of medications and new devices. So it's kind of on the back end, that B2B domain.
Well, what's really cool about this is that when you mentioned the credentialing, right? So imagine that expanded across regulatory providers and credentialing of any entity within a business ecosystem, regardless of their role in an actual real-world business ecosystem. That's what we live in every day. We just don't think of it. We don't think of how many stops a Egg McMuffin made on the way to McDonald's, but it's there. We're a part of it every day. So we're actually looking into CBD markets and market emerging ways to treat pain medication, because that is a huge part of healthcare delivery at this point, especially in my home state of Kentucky. And what that supply chain looks like, and how can you validate credentials of entities like regulators, law enforcement, retailers, and whatnot. How can you get them all on one system where everybody knows everybody and everybody can trust everybody, which, again, is commoditizing integrity.
Mm-hmm. No, that's a good point. That's good, good use case. I hadn't thought about that one yet. One question I get quite a bit, Brennan, has to do with how difficult is it for startups to find developers who have suitable blockchain experience? Can they do you just get existing developers, maybe with a lot of experience, and then learn on the job, or, you know, how somebody who wants to be a developer in blockchain get up to speed, and how difficult is it to find these folks now?
Again, so we're in this, like, what I would consider, I don't want to call it purgatory, that's too mean of a word to put it, but we're in this phase right now where blockchains have evolved in their own languages. You look at Ethereum's blockchain, you look at Golang, or whatever, but it's a year or two from now, it's not going to matter. It's going to matter whether you know C or Java or something else, or know something that can write on top of platforms that can disseminate among different network languages. Right now, the struggle I have seen in the healthcare space is to really find the programmers that understand the business strategy and applying that to the development roadmap. So thought leaders as much as programmers. It's learning a new language is never easy, even if you are skilled and adept at that. So one of the challenges that we've addressed on Blockchain Healthcare Review is to be able to really have a wide talent pool to pull from, but also the leadership to guide them. I myself am not a developer. I wish I was, but it's just not something that ever stuck with me. But finding the right team really has to do with making sure your strategy is in line, because if you're still in business 4 or 5 years from now, you're not going to need a single Solidity developer or a Golang developer. You're going to need a team that understands multifunctional, multi-capable language development, environment development, and whatnot. So my suggestion, I guess, would be look at it project by project, but also look at it from try to start with those developers. And there's plenty out there that have actually developed stuff and stuff that's working, and kind of go from there. It is kind of a struggle, and you can't spend a lot of money very quickly, especially if you go to large scale development firms. But then again, you're not going to get the strategy expertise you would from more of an innovation firm type perspective. So it's a struggle this year, but the good news is there is a lot of education effort being put on that front. I spent last summer in Colorado, and I saw some of the local universities actually putting blockchain, it was Solidity programming, but it doesn't matter to me as long as it's getting into the academic spectrum of this is an important business skill to have if you're going to be in IT. That I never saw growing up in the 80s and 90s and early 2000s. I never saw that outside of those that were purely destined to be programmers. So I think within a half a decade or so, that will be ironed out pretty efficiently. But as of right now, do your homework. Make sure that they understand where you're going and what your business strategy is going to require from a blockchain, development perspective, and then try to pick and pack from there, because there are quite a bit of them out there.
You know, I remember the first few years. You're a little bit younger than I am, but the first couple of years of the internet, it was very difficult to find good web developers. But then a lot of tools came out pretty quickly.
Exactly.
And we're probably going to see the same kind of thing, and that's kind of what you mentioned. I think one of the most needed skills right now is somebody with business experience that you mentioned, Brennan, that use case analysis. Where does it really make sense to use the unique attributes of blockchain technology, and when is it appropriate to bring those to bear? And it may just be a small part of the full stack that somebody's working with, but to know when to use it, and that kind of thing is important. Now you mentioned Ethereum a few minutes ago. Ethereum certainly a giant public blockchain. What gave it a big boost was those concepts of smart contracts. From what I see, they're certainly not ready for prime time now, just because the number of transactions per second they can do. What are your thoughts on Ethereum, and are they going to be able to solve those scalability issues?
I'll speak from multiple vantage points. From somebody who has sat on the procurement side of enterprise blockchain, somebody who sat on the innovation side of enterprise blockchain, and somebody who's pretty much sat on everywhere in between. No, I don't. I like Ethereum. I like Vitalik. I love what they've done to the industry. They are absolute game changers in what they brought. But I don't see it being what I would consider. I don't even know how to compare it. I wouldn't consider them being the foremost driver of adoption across the spectrum. So if you look at the evolution of blockchain 1.0, Bitcoin, very simple proof of work, whatever. Very black and white. Smart contracts as a whole were blockchain, what I would consider blockchain 2.0, and that's what's called in the industry. They're not the only ones to do smart contracts anymore. And, Stellar, I've seen Stellar come up with healthcare use cases in the medical record space simply because it has high transaction throughput, something that Ethereum literally cannot provide, and why that startup chose Stellar specifically because of Ethereum scalability issues. So Ethereum, you got to kind of look at it with a grain of salt. They got kind of a bad rap in 2016 and 17 because so many ICOs were being listed on Ethereum that it bogged down the network. That wasn't their fault, and neither was a DAO hack, but that crushed Ethereum's profile, right? Yeah. So I think if anybody can make Ethereum what Ethereum is destined to be, it is their leadership. It is their idea of a global computer. It is how it was founded. But take a look at blockchain 3.0 coming out. That's where I've spent the last 6 months of my time looking at the interoperable, even quantum key distribution functions of these new platforms. They're going to blow Ethereum out of the water from a security standpoint. And I do know from jobs and projects that we've worked on, especially in the federal space, that's a non-starter. Working with something like if you can't control the transaction speed, or if the network gets bogged down again, that's unacceptable in enterprise space and extremely unacceptable in the defense space. So, looking at hybrid solutions, Quorum, for example, or looking at some of the new blockchain 3.0 solutions where you can have this either hybrid setup or you can have the private scalability in an internal network secured environment. That's not something Ethereum is going to evolve into. And personally, I don't think it should. Ethereum has staked their position in the history of blockchain, and they should stick to it because that's what they're good at. And I do believe that they will continue to do good. I just don't believe that they're going to be as integrated as everybody thought they would in the original launch.
I agree with you there, Brennan. They've done a lot of good. What the future, and they're still a big presence. I kind of read a one-sentence thing on them yesterday that if Ethereum is going to change the world, they probably need to go ahead and do it and not wait 2 or 3 more years.
Well, it has, though, if you think about it. I mean, it has. We wouldn't be having this conversation if it has. It has changed the world. It's a question of what else can change.
That's exactly right. Yeah, no doubt about that. We're almost out of time. Let me hit you with one more quick question.
Sure.
How can someone get in contact with you?
BlockchainHealthcareReview.com. Go there, check out our editorial, subscribe to our editorial, or find me on LinkedIn. And start a discussion. Happy to plug you in. Happy to find and provide information, any and all information that we can help get to you and get to the public and get to those key stakeholders and decision makers in startups. So blockchainhealthcarereview.com get started kind of explains who we are, where we are, and how you can fit in. Or like I said, otherwise is connect with me on LinkedIn as well.
Okay, great. Well, to our audience, thanks for joining me on this episode of the Tate Chronicles. I offer a special salute to my guest today, Brennan Bennett. Brennan, thanks for coming aboard today.
Absolutely. Thanks for having me.
You can find more information on this show's program page at HealthcareNOWradio.com. Until we meet again, here's wishing you smooth sailing and safe harbors.